want to welcome everybody to this session on the Global Fund for the next 5 years. My name is John Monahan. I'm a Special Advisor for Global Health Partnerships at the U.S. Department of State. I'm the co-moderator along with Rachel Ong, who is the communications focal point for the community's delegation on the Global Fund Board. So I'm going to leave it to have Rachel introduce our panel and begin our session. Thank you.
Sure. Good afternoon, everybody. It's nice to see a good big crowd. It means that everyone still cares for the Global Fund. We all know that the Global Fund has undergone tumultuous changes in the last year and reforms. These changes are not unique to the Global Fund. There has been a huge change as well in the entire health landscape and architecture that has affected donor responses and in turn impacted real lives, real communities on the ground. So this session will be focused on the strategic directions and future hopes of the panelists seated up on the stage. The next 5 years are going to be crucial if we want to turn the tide and put an end to the epidemic. So I'll just have a very brief introduction to our panelists. We have Gabriel Jaramillo from Colombia, who's the General Manager of the Global Fund. We have Dr. Eric Goosby, who is the United States Global AIDS Coordinator, who directs the US strategy for addressing HIV and AIDS. We have Michel Guigues from France, who's the French ambassador for the fight against AIDS and communicable diseases. Dr. Kamal N. Sirigar from Indonesia, who's the newly appointed AIDS Prevention Commission National Secretary for the National AIDS Commission in Indonesia. And we have Nadia Khafif from Morocco, who's the director of the Marrakesh Division of the Association Against AIDS. She's also the Civil Society Action Team Coordinator for the Middle East and North African region, and the UN AIDS Program Coordinator Board NGO representative for Africa. Then we have Deputy Minister Henrietta Zulu, who's from South Africa, who is currently serving as the chairperson of the Inter-Parliamentary Union Advisory Group on HIV and AIDS, the UN AIDS Review Committee, and the co-chair. And she also serves on the UN Agenda for Women and Girls on HIV and AIDS. So we will start with Gabriel.
Thank you.
No caps on our lives, and AIDS, 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 no caps. No caps on our lives! No caps on our lives! No caps on our lives! And AIDS! 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 No caps on our lives! And
oh, you need to let your speakers speak now.
We are here today as people from around the world, particularly from developing countries, who are in desperate need for a fully funded and strong global fund, because we urgently need massive scale-up in life-saving services in order to turn the tide and end the epidemics of AIDS, tuberculosis, and malaria. Ending AIDS takes more than talk. It takes full funding, full ambition, full scale-up. Gabrielle, we are here with a specific message for you and for the members of the Global Fund. 10 years ago, we fought to create the Global Fund. We fight every day to fully fund the Global Fund by working tirelessly, challenging governments around the world to invest in saving lives. And we are fighting to ensure that the Global Fund's principles are not compromised by a new funding model. Donors have proposals for a new Global Fund funding model that attack the core principle that real country expressions of demand for services drive proposals, rather than arbitrary allocation determined based on how much money is available at a given point in time. We reject those proposals. We say no to any proposal that would gut the demand-driven principles of the Global Fund. An AIDS-free generation will not be achieved with a Global Fund that sets envelopes for countries and regions, arbitrary caps on country requests, or creates random lists of fundable interventions. The new funding model must be demand-driven and must not cap demand from our countries. If not, we will be the ones to suffer, our communities, our families, ourselves.
Good afternoon, everybody. In my 18 months of navigating in global health, I've met a lot of people, but I have to say that you are truly the best. You're the most original, and you have made such a wonderful contribution to the world that sometimes I think you're not even conscious of that. You have mobilized the world to be just. You mobilized the world to respond to a reality that it was not being addressed. But the world has responded, and many things have happened during these 10 years because of what you have achieved, because of what you moved. Now, after 10 years, we're getting ready for the next 10 years. And my view of the fund, going forward for these 5 years, requires a transformation that the board very bravely, and I think very boldly, responded to last year. And it created a strategy and gave a mandate to prepare our fund, your fund, for the next 5 years. And I've had the honor to have that task, the task of making those changes in a way that are truly, but absolutely, truly loyal to our principles, our mission, our vision, our values, and our strategy. I will share with you a few broad brush ideas of the changes we are making to prepare for the next 5 years. And then I will share with you a personal experience of the fund that I see coming up in the next 5 years. The fund has been absolutely wonderful. The results are spectacular. We have more than 140 countries engaged in the war against the 3 diseases. That has been mobilized over the last 10 years. The results are impressive. You know them better than anybody else. But much has to be done yet. And that's why we're transforming and in a bold way responding to what is coming in front of us. As I look at the changes we're making, I've categorized these changes in 3 categories. The first one is organizing to deliver. That is, getting our Geneva organization prepared for the kind of changes that are coming up. It's rather mundane work, but it has to be done. Our financial reporting, our fiduciary responsibilities and management of risk, our human resources, our systems and the use of information has to be brought up to the challenges that we're going to face. Much of that has been done. It's never done, but great people will be working on that for the years to come. There's 2 major aspects that are taking our attention now in the transformation, and you have addressed one of them now, and it's how to invest strategically. At the beginning of this war, in any direction you would shoot, you would hit the disease. In this second phase, it's more sophisticated, it's more difficult, it's marginalized populations that sometimes we don't know where they are, but they're there. Sometimes we don't know where they are because there's laws and societies and all kinds of cultural aspects that hide those populations. And we have to find a way, to reach those centers of burden, because it is a war against the 3 diseases. And then we will be responding in a way that is palatable to all in the community, but that will allow us to invest strategically. And investing strategically has to do with very high returns. But when we translate that to a concept of fairness, it's about reaching those that we have not been able to reach and those that are difficult to reach because there are walls and barriers that we have to break to get to them. The other aspect is about once we have made the access to funding defined, the countries have to apply. So we are responding with changes and facilitating the way that countries will apply for the money to be able to carry out the programs that are important and strategically defined by the countries. Then the other one is, once the countries have applied and the funds have been approved, how we process those applications in a way that it's fast, that it's responding, so that we put the money to work fast. And then how we monitor the grants, so we facilitate the work of those heroes in the field that are doing this fantastic work, most of you out there, reaching our populations, our final customers, our patients, so that they receive the prevention or have the diagnostic that they require, and if so, the treatment. And so this is what the reforms are about, and I think the team that you have in Geneva and the fund is ready to deliver this, for you under a mandate from the board. But I would just like to emphasize that this is not something we can do alone. We're just a few in Geneva. It's something that we do with our partners. It's something that we do with you. It's something that we do with the countries. It's something that we do with our other bilateral entities that are doing similar work to us in the countries. It's something that we do with the development agencies of those that are providing the funding so that we can do this fantastic work. And it's all about, with all that help, making life easier so that we can save more and more and more lives, because we are more efficient, because we are more targeted, because we are more focused, because we know very well what we're doing. I'd like to share with you the kind of fund that I see in the next 5 years. And the way I see it is a fund that supports and it's a force in attaining universal coverage. Nothing less than universal coverage is acceptable. We will have intermediary milestones and goals, and so many millions by this date and so many millions by the other. But at the end is anybody that is infected with HIV/AIDS has to have treatment. And we have to have that as our maximum goal. And that is what the Global Fund of the next 5 years is gearing up to. We have to build in the countries, with the countries, systems that have the capillarity to reach the final communities, all the populations in the countries where we have burden of the 3 diseases. It's no use just reaching universal coverage if we're not building health systems that will support for a lifetime, the delivery of these treatments. And, of course, we will have to assist all those that are living with HIV/AIDS. Because even if you're treated and your quality of life is good, just by the fact that the person has HIV/AIDS, things tend to complicate more. And we have to be there through those health systems to assume that reality. An AIDS-free generation gives us a chance to organize. It is a fantastic opportunity and strategically important to be able to have that breathing space that will give us the opportunity of reaching universal coverage and creating those basic health systems with capillarity all the way down to the smallest communities so we can truly continue delivering the services. I'll share with you an experience that I had visiting Ethiopia last week. And I visited and traveled in the north of the country, in the Tigray region, to oversee our investments. And I had a chance to visit the Agulai Health Center and the Jemede Health Post. As you may know, Ethiopia has done a remarkable job and is one of the best investment stories we have. They have built an impressive health delivery system that is providing fantastic payoffs. A network of 2,800 health centers, 1,200 financed by the Global Fund, and many others by PEPFAR. They serve 25,000 people each one of these health centers. But they're supported by 15,000 health posts, coming right down to the capillarity, down to the last village. We have financed 1,100 of those, and they employ 35,000 health extension workers, and they're serving communities in urban areas and in the most remote rural areas. I spoke to one of those health extension workers. She had 8 years of experience, and she was training under a Global Fund grant another health extension health worker. And we were able to see how they were truly able to provide the services that are required in this country that by 2014 will have achieved universal coverage in its first definition. But the level of granularity that has been built is amazing and gives us the guarantee that in the years to come, treatment will be available to those that have commenced their new life under a continuing treatment on HIV. The returns that we have had, we have invested the equivalent of $2 for every citizen in this country, $2 per citizen. And for those $2, we have seen that ART coverage increased from 6 to 66%, 6 to 66%, 280,000 people. And we just signed a grant last week that will take us to universal coverage by 2014. BetNet coverage against malaria went up from 4% to 100%, and we signed a grant last week to replace the first BetNets of that universal coverage. And the health infrastructure that I just described to you covers 92% of the population, a country with more than 80 million people. And the impact is very impressive, and this is the real story. HIV mortality is down 50% in Ethiopia today. In the last 5 years, malaria deaths are down 40%. TB mortality is down 32%. Under 5 mortality declined by 50%, and maternal mortality declined by 30%. And we're just reaping the benefits of having constructed this process. But I know that in the back of the minds of many people, there is this fear of what kind of an entitlement and what are we signing up for? Can we really keep up this great thing that we're building? And I think it's time to do the numbers on this because the numbers are compelling. And the conclusion is, don't worry about it, we can. We can. It's cheap. We can. We can have universal coverage and we can have sustainability. And we couldn't say that 3 or 4 years ago. We can say it today because of the quality of the drugs that are available and the price at which they're being reached at. And this is a fantastic thing. Once a health system is built, we can deliver life-saving ARTs at an average drug price of $125 per patient. When I do the numbers on Ethiopia, 500,000 people will be covered, 480,000 to be precise, but let's use 500,000 because it's easier to multiply. And the cost will be, at today's prices, $125 per person. And frankly, we talk about the cost of delivery, but we have the health system. It's been built. It's there. We can deliver through that pipeline with very little marginal cost in addition. And that should give a lot of confidence because the total cost of sustainability will be $65 million. Now, that's a lot of money, but for a country like Ethiopia, it is perfectly absorbable. We should not worry. Ethiopia will be able to carry on for a lifetime with this fantastic ethical responsibility that we all have and that you have shown us the way to assume it. Civil society, you are just beginning. You have brought us here, but in the next 5 years, you have a long way to go because you will have to break the walls and the barriers to get to those populations that we are not being able to even identify and get to them. And this is where you can play, and you are playing, a fascinating role. But don't get tired. You have a long way to go. This movement still has to break the barriers in many countries of laws that make no sense and cultural barriers that don't allow us to get the job done. Thank you very much. It's been a pleasure being here with you.
Our next speaker is Ambassador Eric Goosby. And I wanted to let the audience know Ambassador Goosby will be leaving the stage about 3:30 for another commitment, so we wanted to let you know ahead of time. Ambassador Goosby.
Thank you so much. We really are at an historic period for the Global Fund. There have been dramatic changes in a remarkably short period of time under the leadership of the General Manager and his team that are intended to transform how the fund provides and manage resources to fight HIV/AIDS, tuberculosis, and malaria. The United States government applauds Gabriel Jaramillo's leadership and the impressive pace of reforms. We're heartened by the fund's commitment to crafting an organization oriented around grant management and the populations these grants ultimately serve. with enhanced focus on risk management, grant management, financial oversight. We've turned a corner and must keep moving toward the implementation of the new Global Fund strategy for 2012 through 16 and further reforms on the ground. We need to join together in our shared obligation to focus precious resources in order to save more lives. This is the basis of the bold statements calling for an AIDS-free generation made by Secretary Clinton and President Obama. The strategy adopted by the Global Fund Board last year is a critical roadmap for the next 5 years. In addition to setting ambitious targets for lives saved, the strategy sets out a path for the fund to become more nimble, more strategic in its investment portfolio, employing an iterative funding model with increased emphasis on high-impact interventions, grant implementation, and actions to mitigate risk and maximize impact. Critically, a central tenet of the strategy is improved coordination and joint planning with partners, including U.S. government health programs in all 3 diseases. The Global Fund will be making significant changes in the way that it provides money to recipients. The new funding model will ask partner countries to make strategic decisions cognizant of and complementary to existing domestic and other donor investments while supporting the latest scientific findings and national disease-specific strategic plans. Programs that reflect country ownership, national strategies, and strengthening of partner country institutions for sustainability are the critical ingredient. In order to achieve a durable response to HIV, AIDS, TB, and malaria, both donor and recipient countries must sustain and increase their political and financial commitment to the effort, build country capacity to lead and manage a national response, and institutionalize the inclusion of diverse stakeholders in funding and policy decisions. Those who use the services, those who depend on the services, are critical for both planning and implementation considerations. The Global Fund model is designed to support these goals through programs that evolve from national plans and priorities, disperse funds based on performance, and achieve treatment targets. The 2012 to 16 strategy and consolidated transformation plan will facilitate this transition to greater country ownership and increase the impact of Global Fund grants. Through financial and technical collaboration with PEPFAR, the Global Fund, UNAIDS, our UN family, and WHO, our country partners, including governments and civil society, NGOs, and faith-based organizations, must be supported to own and lead their national responses. Country ownership is also about demonstrating leadership and accountability at all levels. As development partners, we are committed to assisting highly affected countries with the technical assistance and capacity building collaboration they need to move a sustainable national AIDS plan and response forward. The country coordinating mechanism demonstrates this, drawing on the active participation of civil society as well as government, the private sector, again, faith-based organizations, NGOs, external partners also participate. It provides an opportunity for collaboration among all sectors involved in the fight against the 3 diseases in order to achieve an effective and, most importantly, sustainable health response. To build upon the programmatic gains of the last decade, joint planning by the U.S. government and the Global Fund must be critically improved. Already, close collaboration between the United States and the Global Fund is happening on many levels. We need both the PEPFAR and the Global Fund to be successful, convened by partner countries in support of country-owned strategies and with buy-in from the country coordinating mechanism and civil society. Several countries already offer impressive examples of this collaboration, but we must be vigilant and insistent on holding this accountability. The United States investment in the fund contributes significantly to the success of U.S. bilateral programs across the 3 diseases, which are complementary to and deeply interdependent with Global Fund finance programs in many countries. Support for AIDS programs in many countries is increasingly a mix of domestic, Global Fund, and U.S. resources. PEPFAR bilateral and Global Fund resources are often both present at the site level. A degree of interdependence and combined with country-provided co-financing of health systems and services represents progress toward shared responsibility. As a result, all partners need to understand where the other is working and where their programs are going. The same is true of our investments in malaria and tuberculosis. In Tanzania, Angola, and South Sudan, the Global Fund grants help support the purchase of antiretroviral drugs, while PEPFAR supports training and the delivery of ARV drugs to patients. In Malawi, PEPFAR resources support targeted elements of the national response, while local entities are supported financially by the Global Fund. Together, PEPFAR and Global Fund finance programs provide treatment to close to 289 people, reaching about 70% of those in need. In addition, the government of Malawi targets Global Fund financing to deeply rural communities where 85% of the population resides, working through district governments and local community-based organizations. PEPFAR bilateral funding is then targeted to HIV needs in more urban populations. In Rwanda, the national government is a strong partner in the management of PEPFAR programs and Global Fund resources. Indeed, they play the convening role of defining unmet need, prioritizing the unmet need, and making the allocations from both their resources, Global Fund, and PEPFAR. PEPFAR funding was initially used to support the base of the HIV/AIDS response in Rwanda, including treatment. The government of Rwanda is now using Global Fund financing to pay for long-term health service costs. This shift allows PEPFAR to focus on quality assurance of services, expanding support for human resource training, and strengthening the capacity of civil society, allowing us to, in concert, work with the Rwandan government to allow for continuation of existing program, but at the same time position Rwanda so they can look ahead to that 3 to 5 year trajectory to anticipate need and meet it. In several countries, health service costs are being transitioned to partner governments with Global Fund financing, an important step for us all to watch over the next 5 years. This transition not only demonstrates country ownership, but allows PEPFAR to focus increasingly on technical collaboration with the government rather than direct provision of services. As we move aggressively to a sustainable response to HIV/AIDS, PEPFAR, the Global Fund, and partner countries are working more closely together, ultimately producing an overall decrease in costs while saving more lives. In this time of global financial constraint, it is more important than ever that we work towards one united response to save the most lives possible. For its part, the Department of State is standing up a new Office of Global Health Diplomacy. This office will champion global health as a priority in the diplomatic arena and work to increase coordination among the United States partner countries, donors, stakeholders, including multilateral organizations. Based on the progress on reform implementation to date, over the next 5 years, we expect to see a Global Fund even more committed to safeguarding resources, impeccable grant management, and with a renewed focus on the countries with the greatest burdens of disease to save more lives. Thank you.
I'd like now to invite Nadia Rafif to the stage.
Good afternoon, everyone. It's a privilege for me to speak with all of you today. As the only civil society speaker for this important session, I want to bring a community perspective to our discussion on the strategic direction and future hope of the Global Fund. I have thought a lot about this, and I have solicited input from many of you here and many other civil society all around the world. And I tried to narrow my thought into several key areas of concern. First, the restructuring of the Global Fund. Secondly, how restructuring has negatively impacted HIV program. Third, the demanding of the Global Fund structure to engage with civil society. Then the new focus on high-impact country. And finally, the demand-driven model in peril. But first, let me start by affirming very clearly with civil society engagement is critical to achieving maximum impact at the Global Fund. Let us be clear, the Global Fund is also our fund. A concerted effort must be made to support linkage and synergy between civil society, Global Fund, and program implementers. We think that civil society is still not included properly in the current critical decision taken by the Secretariat, and we all fear that the transformation in place will put us far away with the golden model of demand-driven that was the initial philosophy of the fund. Having spent the last 10 years working on HIV in Morocco and the last 4 years in 19 countries in the Middle East and North Africa region, I can personally attest to the radically positive change imparted by the Global Fund. I saw treatment waiting list of AIDS patients disappear when previously individuals in need had to wait until someone died. I have seen extremely marginalized and excluded groups, including in the Middle East and North Africa, men having sex with men, sex workers, persons who use drugs, regain their dignity and full access to the same quality healthcare services as any other citizens. I have seen NGO actors negotiate on equal terms with government representatives about the HIV funding priority in their country and how best to manage international AIDS. We all say that we need to invest strategically. I think that as the ultimate beneficiary of investment in health and an effective response to epidemic, communities are able to provide unique feedback about the quality and effectiveness of programs funded by the Global Fund. In Eastern Europe and Central Asia, for example, civil society and key affected populations are the most vocal proponents of evidence-based practices and measures to protect human rights. As the ultimate beneficiary of investment to health and an effective response, we are able to provide unique feedback. As civil society, we have the daunting life-saving task of ensuring that the world does not backtrack on gains so far made. If the global community is to prevent this potentially enormous setback threatening the health and life of millions of people, and realize the numerous commitments made by United Nations member states through the Millennium Goal and at the high-level meeting, swift and fast and decisive action has to be taken. The Global Fund is also our fund, and it's the best mechanism in the world as for realizing the possibility of a world without AIDS. I would like to convey the key concern held by civil society regarding the Global Fund. You say that we don't have to worry, but we are confused and we worry. We are all confused, not only civil society, but government, CCM, beneficiary of the fund, and the community we all serve all around the world. Everybody is confused. We hear about the 50% rule, the 10% rule, the priority country, the high-impact intervention. We hear about abolishment of civil society department, departure from people from Geneva we were working with. For my part, I received so many telephones from civil society from Middle East for asking me questions that I was unable to answer until now. When when we ask questions, we are told to wait, but time is running, and I would like to highlight several specific issue areas of concern. If the Global Fund scale back now, the negative impact on individual and community will be devastating. And in fact, these negative effects are already being observed in many countries. I won't detail too much, but you know that first program interruption with the cancellation of round A level. And now in many countries, it's the source of problem with grant dispersed very late, leading to human resource without salary, for example, in Mali, in Burundi, in Nepal. The transitional funding mechanism is also problematic. The principle behind the TFM was supposed to be the continuation of the funding for essential services. But we cannot enroll new patients. And when we hear that only essential service can be funded, and at the same time found out that new patients are not being enrolled, it sounds like treating new patients is not an essential task for the Global Fund, and it's truly unacceptable. Drugs stock out. In Mauritania, for example, the combination of a complex bureaucracy coupled with confusion made by the recent Global Fund change lead to a late disbursement of the Global Fund money. Also, Mauritania learned at the last minute that they could apply to TFM. They prepare an application, but this late disbursement still will lead to a stockout of IRV very soon and no new eligible patient. The two last points, the Global Fund structure to engage with civil society. We used to work with civil society within the Global Fund. We are also worried that some of the recent change to the structure will weaken civil society communication and cooperation with the Secretariat, and that this will hinder the Global Fund effectiveness, risk management, and sustainability of program. Before the civil society involvement was facilitated through the civil society partnership team. So now we know that it's supposed to be integrated through the different departments and portfolio, but some of which may or not have the skill, the capacity, or the commitment to have an overreaching aim of maximizing energy with civil society. We also understand that within the new structure, the fully functional CCM team will be diminished to a 4 smaller CCM hub, and from now on, the main responsibility of building partnership will be with fund portfolio manager. You say to us, don't worry, the CCM function will be mainstreamed into grant management, but these reassurances are too vague or to be meaningful. If the Global Fund program are dictated from Geneva, the program priority will be wrong and there will be no country ownership or bad implementation. If you don't ensure the CCM works properly, and you will have a lot of huge conflict of interest inside the CCM. That is why the Global Fund must dedicate the staff necessary to liaising with CCM to ensure that all members fully understand and respect the letter and the spirit of the CCM guideline. Our CCM will listen to the Global Fund. We fear also, coming from a Middle East and North Africa country, and we are particularly concerned about the Global Fund new emphasis on high-impact country. You are talking about impact, but what is the difference between a person in Morocco, in Argentina, or in Zimbabwe receiving treatment? How will we be able to measure this change and that the change are working? We want to save as many lives as possible, but what's going to happen to middle-income countries with low prevalence but with concentrated epidemic among key population like men who have sex with men, sex workers, transgender people, and injected drug users? In this new structure, regions where concentrated epidemics are exploding, especially Eastern Europe, Central Asia, and the Middle East, North Africa region, will go unfunded. Many countries are transitioning from low to middle income, but poverty in middle income countries remains very high. For example, 60% of the world's poor people live in 5 middle income countries: Pakistan, India, Nigeria, China, and Indonesia. Finally, I want to come to my final point, which is the demand-driven model in peril. Ensuring that the principles that anchor the Global Fund are left intact. Here, I'm talking again about our fear that many governments are proposing a new global funding model that abandons the demand-driven principle of the Global Fund and embraces caps, hard caps, or allocation on what country or region could receive. We believe this will be a disastrous mistake. Because at the moment where science is telling us that we can fight to realize the end of AIDS, if we have enough funding, the right policy, and the right intervention, capping or limiting country or restricting demand completely contradict our shared goal of a demand-driven fund. Are we doing the thing right rather than doing the right thing? We say no to this approach. As the people waiting in line for services, as the people the Global Fund has been established to support, we say no. Therefore, we are asking key leaders, such as you on the panel, to commit yourself, where we are calling on you to stand with us. So I'm asking one of the colleagues to come here. So, as the world prepares to embark on a course to end AIDS, and as the Global Fund reviews its groundbreaking model, that I will defend the demand-driven Global Fund and oppose any measure that undermines scale-up, resource mobilization, or universal access. In particular, I will oppose proposals to create ceilings or envelopes that cap country ambition when applying to Global Funds.
So I've been informed that Eric would need to leave now, but before that, I have something to share. I think with just a short summary of what we've talked about just now when Rosemary came onto stage, there was this really strong will not to undermine the demand and undercut commitments for a truly inclusive global fund and not become a low-income countries or selected interventions global fund for AIDS, TB, and malaria. So we need global coherence, Eric, and our various donors. And we need that to be truly inclusive of civil society. So thank you for your time, Eric. And I'd like to introduce our next speaker, Ambassador Mercier Guegas.
Help me, please. Hello, everybody. I'm so glad to be here with you talking about the fund. our beloved fund. We really care for the fund. So the question we have to address today is a very challenging one. But it is also limited in scope because what are 5 years? The time is running so fast. When thinking about the near future of the fund, I asked myself, and with me France, asked 3 questions. First, what could have a positive or negative impact for the fund as a global mechanism, as a vertical financing mechanism? This is the global fund. Second, what could potentially strengthen or impede the performance and legitimacy of the Secretariat? So the fund and now the Secretariat. Third, what could be the consequences of the new grant model for the patients, because we want the best for them. So look at this. This is not such a complicated slide. This is my roadmap. On the green side, potentialities, opportunities, positivity. On the red side, some risks we have to avoid. I am not going to comment every point. I just want to let you read and to comment a few points. Among these few points, money. For the fund, even if we do reduce costs and so on, we need more money. We know that. To have 7 million people, 15 million people under ARV, to have a large scale-up against TB and against paludism, we need some money. So I think that on the right side, the green one, we really have to think and to commit on new and innovative financing. I'm not going to once again repeat what my president said about the new financing, but in our view, ODA will not be sufficient to fulfill all the gaps of poverty. So we really need to work together for these new innovative financing. Same thing for market dynamic and intellectual property barriers alleviation. If we want to save people, we shall be ambitious about intellectual property. We must share the knowledge. Of course, we have to remunerate the research, but we have also to alleviate the barriers of IP, intellectual property. On the red side, we have a huge challenge. This is not only the fund responsibility. This is a global community and political community responsibility. One of these is not to deprioritize global health. Here is a true risk. As far as we know that we are not going to fulfill the Millennium Goals, everybody is running everywhere, you know, agriculture, nutrition, food, education, and so on and so on. But here, our task, our responsibility is to try and to obtain that global health is not deprioritized. We have also the risk of a competition with other diseases, and especially non-communicable diseases. What does it mean? It doesn't mean that we shall not take care of people having cancer, for example, but it means that it's not time now, to stop our commitment for our 3 diseases. Impact of negative communication, this is so important. We have to defend the fund. Now, potentiality and risks for the Secretariat. I think that Gabriel is doing a great job, but in a sense, maybe he doesn't tell us, but sometimes he could feel a little bit alone because the board of the fund is weak. You know that. You have to know that. The board of the fund is weak. We have to have a courageous governance reform. I would be glad to answer your questions. We have to have in this reform an effective and balanced dialogue between implementers and donors, and much more ownership. But this is not a negative way to express it. This is a potentiality. This is my roadmap within the board of the fund and within the different committees. Now, what are the risks? The risks for the Secretariat is a global fund, no more global. I'm not going to comment too much. You see what I mean. And also, a risk is maybe going on harsh power struggles between donors to dominate the fund. You see, we have some political strategy behind our head. I think that the fund is our common good. So take care of this point. We have to take care of this point and not have a hyper power or a second hyper one or the third hyper one wanting to dominate the fund. The fund belongs to all of us. This is a risk. The last risk, and this risk is in my and our roadmap, not to make an error in ED casting. We have to choose a new ED. France was prepared to continue with the previous one. I shall say that. But the previous one decided to leave us. So now we have to recruit another one, preferably a lady from the south, any south. But we are discussing a lot about what is the best ED for this fund. And I shall tell you that we do not only need a bright manager, we do not only need a bright communicator, we need a visionary. What does it mean? What does it mean to have vision? It's not like Martin Luther King, peace to Martin. It's not, I have a dream of a global fund going to the moon. No. The vision is to be able to understand the signals around the fund, the signals coming from the world. This is what vision means in our view. It's not, a religious way of telling it. Each and every bright leader in every industry has a vision. We have to have one with a vision. Now, and this is good for the Secretariat to have, such an ED. And now, my third question was about the patient, because our ultimate goal is the patient. As I said, these are true people. They have a face, a smile, despair, hope, faith. We have to take care of them. And what could be good for them, or maybe not good? What are the risks and opportunities? First, we want a fund that can be able to differentiate its approach and have more flexibility. We want a fund able to make quick disbursement. We want decisive progress in cost effectiveness. This is not a shame to talk about cost. And we want, and France wants the fund to be a front runner. We do not want a fund that role is only to fill the gap. I don't believe in that. During these 10 years, if the fund wouldn't have been a front runner, we wouldn't have had such a support, such a collective and global support. We need a front runner. It seems to us that the fund can be this front runner. What are the risks? The risk is hypercephalic model. This is typically French, hypercephalic model. A big head full of brain, full of gray matter, and poor hands and legs and broken legs. We don't want that. We do not want also to see this risk of unintelligible and technocratic model with persistent lack in reactivity and blockage. And we would like also a fund that is really able to put incentive for collaborative work. And, you know, at the end, the risk is to have a kind of reform fatigue at all levels. So let's develop this strategy. Let's have the new model. And then let's work. And let's not change every 5 minutes with a board wanting to make micromanagement and deciding whatever, I don't know. So the work is in front of us. We are at the age of the razor. This is what I'm trying to tell you. We can fall on the right side, the plus, or on the left side. Anyway, we will go sometimes here and there, but we have to keep our roadmap on the green side. And this is what I'm trying to do on behalf of my country and in the highest interest of the fund and the patients. Thank you.
Thank you very much, Ambassador. I want to introduce our next speaker, Dr. Sirigar.
Good afternoon, everyone. Indeed, it is an honor to me to present in this panel the case of Indonesia as an example of high-impact countries in Asia. Global Fund started in 2003 in Indonesia, that followed by round 4. In 2006, the government intensified the AIDS control program into a comprehensive prevention, which described in the National Strategic Plan. And this became the basis for Global Fund proposal development. For round 8, then for round 9, that later known as a single stream funding for the period until 2015. The Global Fund played important role providing the opportunity for countries like Indonesia to implement the comprehensive prevention strategy as described in the National Strategic Plan. The single stream funding support the implementation of comprehensive prevention, focusing on most at-risk population in 137 priority districts across the country. This round originated from one proposal that conducted by 3 principal recipients. First, the role of PR from Ministry of Health is to strengthen the services, including the provision of STI, VCT along with CST services, including ARV treatment, PR National AIDS Commission is responsible for capacity building within the network of AIDS commissions, as well as scaling up harm reduction and management of condom distribution. And this is, I would like to highlight that there is a responsibility of PR from civil society, which is responsible for community system strengthening. The services infrastructure as well as community system established could identify the HIV cases earlier. After round 4 started, the number of HIV reported becoming more than twice than the AIDS cases. The Global Fund funded comprehensive program involving multi-sectoral approach was actually just started in 2009, with showing significant changes in 2010. Here, the HIV reported becoming almost 4 times than the AIDS cases. This situation allowed the treatment become more effective to prevent AIDS-related death. The case fatality rate dropped from 19 to 4 by 2010. Only 5% people living with HIV known their status in 2006, and the figure increased to more than 50% in 2011. But now, in relation to the MDG Goal 6, the question is HIV epidemic under control? The recent data reveals the changes occurred during the period 2006-2011, and it becomes apparent when it is projected until 2030. This indicates there are mechanisms that work to begin to control the epidemic. However, to stop the epidemic, what are the challenges? The 2007 and 2011 IBBS shows the HIV prevalence among IDU decreased from 52 to 42. When IDUs have consistently high access to more than 80% to needle and syringe program, the consistent safe behavior increased. The scaling up of NSP program apparently affect the decrease of HIV prevalence among IDUs. However, the same IBBS shows HIV prevalence only slightly decreased among female sex workers. Among transgender, the situation is worsening among MSM. The remaining low-cost condom use and continuing low access to STI services may explain the remaining high HIV prevalence among sex workers. The projection shows that the decrease of HIV prevalence is actually in sight. However, the concerted effort only recently functioning. This has to be working for longer time until and even beyond 2015. The challenges include in integrating key population basic needs into primary healthcare service delivery. For instance, in areas where there are large number of IDUs, the IDUs with fully community support should access quality NSP and also integrated with STI services as entry point to further continuum of care. The integration process should be functioning in all aspects, including between community and continuum of care. Now I turn to the future of what would be the future role of Global Fund. The National AIDS Spending Assessment reveals that domestic role increased from 27% in 2006 to 42% in 2010. The figure would continue to increase. However, it may not achieve more than 60% by 2015. So Indonesia, as high impact country, will continue to suffer insufficient funding. The same situation would happen in Myanmar, Cambodia, Laos, the Philippines, East Timor, and Vietnam. When 2006 data compared to 2010, the increased domestic fund apparently has been used for treatment, and this especially for ARV. The question is, what about prevention? The trend reveals the challenges that the funds needed for prevention and management are still largely depend on external sources. The proposition to the Global Fund includes conferring attention to high-impact countries which has immense number of key population, such as Indonesia. The current support provided, which based on the National Strategic Plan, should be continued until the epidemic fully under control to generate country ownership as well as to further sustain for both the health and community system. Furthermore, when the support will be granted to cover the gap, for the case of Indonesia with concentrated epidemic, keep focusing on key populations. The focus be given to the prevention program that targeted to key population, involve civil society as well as management activities that are more likely to conceive joint planning and monitoring from various stakeholders. Well, thank you.
I invite the Deputy Minister to come up for our final speaker. Oh, you want to say?
Just like all the others. I was waiting for the introduction.
I'm sorry.
So thank you very much. My sincere apologies. I was waiting for the program director to do the honors of telling you who I am, at least my name, rather than the next speaker. But let me introduce myself since I'm not introduced. My name is Henrietta Boopani Zulu, and I'm the Deputy Minister responsible for women, children, and persons with disabilities from the Republic of South Africa. Since we have 5 minutes left before the session ends, allow me to, I'm not sure I'm going to be scrambling, but to just say that, yeah, we have time issues, and I would have to try and see how best I say what needs to be said in the remaining 4 minutes. The first, allow me to send my deepest gratitude on behalf of the people of South Africa and the government of South Africa for the Global Fund having taken the decision to continue to fund South Africa. Our Minister of Health have a saying that says, if HIV was a snake, the head will be in South Africa. And if we can kill the head, there is hope for everybody else. And we are committed, and with your help, we believe we can walk this road together. And we thank you ever so much to the Global Fund, but to all the countries that contribute to it for saving the many, many lives and improving our health systems. We are most appreciating. But allow me to also say that in the ministry that I represent, we like the advocates in government. And allow me to be the advocate for those that I'm elected to serve. And as you'd be aware, HIV and AIDS remains identified with the face of an African woman. That is how when you look at HIV, you see the face of not just an African woman, but a black one too. And even in the United States, everywhere you go, in every country, black women still carry the biggest burden. And their dream for the Global Fund in the next 5 years, they have asked me to say the following. Number one, that they very, very much appreciate the opportunity for the Global Fund to have kept them alive and have serviced and provided services even in some of the deepest rural areas. However, their dream in the next 5 years is that the Global Fund simplifies its very complicated bureaucracy that enables them to be able to get work done and not spend time writing proposals, writing reports, negotiating the funds, that we get those systems simplified and save lives. They've also asked me to say that it will really be an honor and a privilege in the next 5 years if we could make it a little bit long-term commitments that are predictable, dispersed on time, so that they are able to meet all their obligations. Our grantees are struggling because there is some delay, and they are humbly saying, please, in the next 5 years, let's do it smarter, faster, and better. What they are also asked me to convey, their dream of a global fund for the next 5 years, is that the global fund implements the policies that they have, and that the goalpost must not change. Whilst people are getting their heads around this part, the new part comes in, and then the old part goes, so they spend time trying to understand which policy is applicable when. So they are saying, please, in the next 5 years, let's stabilize our systems, let's communicate better, faster, what is expected, so we are able to get on with the job. They are also saying, let's get our CCMs functioning, active, let sectors be represented, and let our CCMs have a say in the structure that they should be, so that it's not a one-size-fits-all. They've also asked me to say that it will be very good, as it's their dream in the next 5 years, if the roles of parliaments can be increased in the next 5 years. It is the parliaments of the world that have delayed the replenishing of the Global Fund. And some of them said, we don't interact a lot. Even though we are required to perform oversight, we don't perform oversight on the Global Fund program. So can we get the authority as Parliament so that we don't only meet the Global Fund when it's time to disburse or to replenish, but we actually become a fundamental part of how the Global Fund does business, and that relationship will improve and actually ensure that when the time comes for the replenishing of the global funds, that parliaments are on their feet and they get it done faster. Because at the end of the day, in majority of our countries, governments don't actually allocate budgets, but parliament do. And when they do, we need to actually lessen the stress of civil society and make sure that parliaments are empowered to do what they are supposed to do, and we make sure that they actually create an enabling environment so that when you fund a program of men who have sex men in another country in Africa, that the parliaments are there to actually create an enabling environment through proper legislation to enable whatever program that the Global Fund is funding, that it not be criminalized. What they are also asking me to say is that they would appreciate if sectoral funding could be explored and understood, where you allocate resources for women's organizations, or specifically for children, or for people with disabilities. I've had an honor and a privilege to interact with the Global Fund in my work for many, many years since its establishment. And one of the challenges that we had as a member of the CCM also in my country was when our country proposal had a strong disability element, and it became a problem for the board members. So that we had to fight for, defend, and I can say that was the beginning of disability making sense in the Global Fund work, and we're proud that we can say disabled people and their organizations in South Africa have been funded by the Global Fund, and they have found solutions that are relevant to their disabilities, and the end is indeed near. Let me conclude by saying, I'm trying to skip around. Let me conclude by just saying a few things. We're very grateful to those that sweat and established the Global Fund. We're also very grateful for the manner in which it was managed. And we have hope that in the next 5 years, the Global Fund will make steady steps to correct whatever that did not work and put in place what works. Because the focus is that we cannot stop now. Acceleration is what we need. The end is on sight. Treatment as prevention does wonders. And if we can make sure that we keep at it at the same steam, at the same authority, we will be able to see some of us in our lifetime an AIDS-free generation. Let's get at it. Let's make the Global Fund work. In South Africa, we say, together we can do more. Thank you so much.
As everybody knows, we're over the time limit, and the screen that we have here indicates there's no time for questions, but I do want to just reflect on the fact that we've had an extraordinary panel with a wide range of perspectives that were incredibly helpful in understanding where the Global Fund is, and most importantly, where it's going. So I want to thank the panelists. I want to thank my co-moderator. Rachel, do you want to say anything to close?
Well, I think just to summarize, I think we've had a huge range of ideas, opportunities, gaps that were identified, that we need global coherence from the donors and implementers. You know, for a fully funded global fund, we know the commitment is there, it's clearly present, yet we also recognize the discord between the rhetoric and implementation. So I'd just like to thank our speakers again, and please come up to the speakers if you have any other further questions. Thank you for your time.
Thank you. Gabrielle, thank you.